Assalamu alaikum wa rahmatullahi wa barakatuh. Dear brothers and sisters in Malaysia and in Indonesia and all over the world, welcome to the live session from Gaza, speaking about the latest updates and the appeal from Amman Palestine for the response of the coronavirus from Gaza and from Palestine, speaking to the whole world about the latest updates and about the latest situation of the effects of this pandemic that has been spread all over the world. And I would like to welcome my guests and my colleagues in the studio, Engineer Mu'tasim Mansour, Programs and Projects Admin of Amman Palestine. Welcome.
Thank you very much.
And we would like to welcome Dr. Muhammad Dwema, Manager of As-Salama Charitable Association.
Thank you.
One of our partners, one of the partners of Amman Palestine that are working and doing the interventions for Palestine. And as a beginning, it is known for the whole world that this pandemic has affected all sectors of life and has affected all sides of life for all the people and for all the sectors of life amongst all the citizens of all the countries. But when it comes to Gaza, it is very special situation because the people of Gaza are living in, or let's say the people of Palestine. It's very special because the people of Palestine have been living the lockdown and the quarantine since the 1948. And when it comes to Gaza, it's even more special because the people of Gaza have been living under the siege for more than 12 years. And as a beginning, to begin our discussion today, I would like to begin with a video that Amman Palestine, Berhad, has already started the intervention in Gaza Strip as a beginning, but the intervention is going to be in all over Palestine. And later on, we're going to discuss with the colleagues and with the guests here about the intervention. So Amman Palestine, Berhad, has already begun the intervention and provided 3 tons of alcohol sterilizers to the people of Gaza. And alhamdulillah, this is with the cost of 18,000 USD, and this will be distributed to the people in the quarantine and people in the hospitals, will be distributed through the Ministry of Health. So let's watch the video first, and then we continue the discussion with our guests. Of the efforts implemented by Amman Palestine Berhad in confronting the spread of the coronavirus in Gaza Strip, Amman Palestine Berhad has donated the sterilizers for the people of Gaza within an amount of 18,000 USD. And this is considered to be of the first actions taken in Gaza Strip in helping and supporting the people of Gaza to confront and prevent the spread of the Covid-19 inside the Gaza Strip. And on this action, we send our appreciation and thanks to the people who donated and to the donors who donated to the people of Gaza to prevent the spread of the Covid-19. Welcome back, dear brothers and sisters who are watching us from all over the world and especially from Malaysia and Indonesia. And it's the chance, I will take the chance to ask you, if you like the video, and to do subscribe, share for the pages of Amman Palestine on YouTube and for the pages of Amman Palestine on Facebook, Instagram, and on Telegram channel. And I also would like to ask you to do the donations to the people of Palestine through Amman Palestine, as Amman Palestine is the channel that provides the donations through the office in Palestine to the people who are really in need and to the beneficiaries all over Palestine, in Jerusalem, in West Bank, in Gaza Strip, and for the people, for the refugees in Syria, for the refugees in Lebanon. So you are most welcome to do your donations to the bank accounts that appear under the screen at this moment and on the pages of Amman Palestine as well. So As a beginning of our discussion today, I would like to take the chance to review the latest statistics of the coronavirus infections in Palestine and in the neighboring countries. So as a beginning, and we have update together, but I want to update to our viewers and I want to update to the people who are watching us at the moment that in Gaza, alhamdulillah, there are 13 infections and only 9 have been cured. And then, alhamdulillah, we have no deaths. In the West Bank, we have 280 people who are infected with the coronavirus, and the ones who are cured are 52, and we only have 2 deaths. But when it comes to Jerusalem, the number we have is 81 infected ones, and the ones who are cured are 5 only. But when it comes to Jerusalem, it's kind of specific and sensitive because we cannot get the accurate information, because the Israeli occupation are taking control of that area and they are hiding information and they don't share this information with the Palestinian Authority. So that's why it's difficult to get the exact numbers. We have the people, the Palestinians who are abroad all over the world, scattered all over the world. We have a new statistics that 760 Palestinians have been infected with the coronavirus all over with the Palestinians who are all over the world. 196 of them have been cured and 37 of them have passed away. So they have passed away also abroad. And when it comes to Israel, and I want to mention Israel because they are the occupiers, and one of the ways that that the coronavirus is being spread in Palestine is through Israel, because in the West Bank they are they interact more with the Israelis than with the Palestinians. So in Israel there are 12,501 infections, and the ones who cured 2,563, and the ones who died 132 Israelis have passed away, as the Palestinians suffer from the occupation virus as well as the coronavirus. Well, as a beginning, dear brothers and the guests who we have here in the studio, can we speak about the reality in Palestine before the beginning of this virus? So, Engineer Muttasim, can you share us, and then inshallah our brother Muhammad can share the discussion about the reality of the situation in Palestine before the coronavirus have arrived to Palestine.
Bismillah ar-Rahman ar-Rahim. First, of course, our sympathy, of course, goes to those our families, our brothers in all of the world, especially in the east of Asia, Malaysia, Indonesia, the one who lost their beloved ones, because of coronavirus. Our sympathy and all our prayers go to them, inshallah. Actually, the most important thing that you have to know, and everybody in Malaysia and Indonesia and all over the world must to know, that the pandemic come to Palestine, but where Palestine actually is, we are living like epidemic or like a pandemic from long times ago, from 1948.
Yes.
We are talking about that. When the Israeli occupation come to our land, we are talking about half our population have been displaced and kicked out of our land. The remaining that remains inside Palestine, living under the most deteriorating conditions, the worst living condition. Actually, we are talking about quarantines. We are living like in big quarantines from 1948, actually. Big quarantine in West Bank, big quarantine in Gaza Strip, and big quarantine in Jerusalem. About lockdown, we're living this lockdown before the coronavirus, actually.
So the people in Palestine, they are suffering the virus of occupation since 1948.
Yes, this is a good description of the situation. Also, when talking about the situation, let's go first area by area. When talking about West Bank, for example, West Bank like living inside apartheid wall. We are talking about 7 or more 800 kilometers surrounding, suffocating the West Bank, around the West Bank, trying making fragmented lives inside West Bank. A lot of checkpoints, talking about 100 checkpoints, maybe fixed checkpoints. We are talking about another 170, like moving checkpoints around the people, making the life of the people of the West Bank, like you are talking from small prison, going from a smaller prison to another smaller prison, and of course there is are talking about the daily lives of the West Bank, continuous attacks on the people, continuous demolition of houses, continuous plundering of the lands, the burning of the lands in the West Bank. They're actually going back to the Jerusalem. Also, they are suffered like direct occupation. Actually, we are talking about there's always like institutional discrimination against the people of the Jerusalem. Actually, yeah, because they are living under the Israeli occupation state. So there's discrimination against them in all services, in education, in health services. You know, even now in Corona now Israeli occupation country now like brutalizing the COVID test, mostly for the Israeli people and like leaving the Arab like Palestinian community that live inside the Israeli states, like making them the last priority. Now even many of them the Palestinian medics try to volunteer and to try to make some medical intervention to them. They also arrest them.
Yes, we have seen this in the videos, and that the volunteers who are trying to disinfect the public places, so the Israeli occupation army would come and would beat them, arrest them, and prevent them from doing this. And as well, we have seen another video that the Israeli soldiers who are walking at night and storming the Palestinian houses, they were spitting on the cars and trying to spread the virus as much as they can.
Moving to Gaza Strip, where we are living now, we're talking about blockade since 2007, blockade in everything, and the lives of the farmers, life of the fishermen, life of the travelers, try to travel, cannot travel abroad for study, for medication. We're talking about deteriorating economy, we're talking 200,000 poor families in Gaza Strip. We are talking about two-thirds of the population in Gaza Strip are considered poor and under poverty line. Coronavirus and COVID-19 come in this situation when everything is deteriorated. Living conditions are fully deteriorated. Talking about medical situation, and Mr. Dwayma can maybe tell us more about this. I'm talking about medical situation. It's actually half of the like essential drugs actually of the stores is depleted from the stores. Recently we just come out from Greater Term March. You know, Greater Term March, there's a lot of load case injuries and patient load come to the health system, the already deteriorated health system. So he already trying to recover from the previous Greater Term March load of the cases. Now we come to the coronavirus with the least preparation. We are talking about a country, or like a budget, or a governmental budget. They barely can pay like 30% of the salaries of the medical worker and the educational worker. So
we can like say that the situation in Gaza, that the people have been living in an open air siege, and the Gazans the Gazans have lived 3 destructive wars within less than 10 years, and then the Great Return March, and then here comes the COVID-19 that will add the load and increase the load on the shoulders of the Palestinians, especially the authorities. So can I ask Dr. Muhammad about the health conditions in Gaza before the arrival of the coronavirus? Just we'll come later for this, but how can you describe the condition, the health condition in Gaza Strip and maybe in Palestine?
Okay, good morning everyone. Actually we are send our solidarity with Malaysian and Indonesian people, and we hope the infected people they are recovery soon inshallah, and we are very sorry for the people who they lost their beloved one or they passed away. For the health situation in the Gaza Strip, the health situation when we talk since many years before the 2007, since 1948 when the occupation came, the situation is going is very bad. The health sector suffering every time the occupation make the health sector in weak position, not in good position. And when we talk the crisis increased in 2008, there is a war, 2012, 2014, and many clashes on the borders. They stopped a huge number of patients who have cancer, who need special surgeries, major surgeries, and they need treated abroad. The blockage not allowed them to go outside. And when we talk about the Great March of Return, which left around 48,000 wounded in the Gaza Strip, all these numbers, it's a big demand on the Minister of Health. And they are facing a big war, and they struggle to give these services for the patient. when we talk about the Ministry of Health, there is lack in the medications. You go for treatment, you find doctor, but you don't find treatment. If you want to book for the surgery, you have a huge waiting list. And they are working day and night to make surgeries for a huge number of surgeries.
4,000 in Gaza Strip,
Now,
and 4,500 in West Bank.
You know, this is 4,000. It is it's a number of in the normal working days,
normal conditions
normal
without
conditions.
crisis.
But now there is a crisis of corona. Imagine that you have corona cases. The Minister of Health, the situation in Gaza Strip, the Minister of Health is fighting to not make the coronavirus spread inside the community, and they try hard to stop this COVID-19 pandemic came to Gaza. Now, alhamdulillah, they are try to control any patient or any people who came from abroad. They put them in a quarantine. But imagine that this COVID-19 is spread inside the community. There is a really crisis. I think it's the worst in between the world, because you are under the siege. There is no enough ICU beds. There is no enough ventilators inside the hospital. Imagine that the capacity for the ICU beds around 60 beds.
60 beds
For
for
2 million
people.
For 2 million
Yeah.
people. And imagine the total number of beds is around 1,000 between 2 million people. And if we talk for other countries who have the same population in the small area, we found the bigger number than these numbers.
Well, this reminds me in the latest war against Gaza in 2014, the people who were injured, they were put on the ground, and the ones who passed away, they were put in the
ice cream refrigerator.
In the ice cream fridges, because Gaza Strip lacks the beds, the number of beds of the.
You know, Mr. Ibrahim, point is like the most modern countries now is like suffering. They feel like overwhelmed by the number of cases. And they are modern and like in medical services. What about Gaza?
Yes.
What Gaza will do if coronavirus will spread?
There's a big main issue that we can talk about. We have a huge number of cancer patients, and these patients, they have a weak immunity. And imagine that the COVID-19 came to Gaza. We are suffering from cancer. We are suffering from malnutrition.
Yeah.
We are suffering from a lot of diseases.
Diabetes also.
Yeah, kidney failures, diabetic
cardio failures. Yes.
And this is a huge number, and also the psychological situation. The psychological situation inside Gaza Strip. There is some studies. They said that 70% of Gazans, they live under the anxiety and depression. And many studies, they said if you want to face COVID-19, you should have a good psychological situation. Imagine all this, the poverty. We talk about 2/3 of population, they are under the line of poverty. We go for some houses, they cannot buy the chlor, they cannot buy any antiseptic material, they cannot buy sabun also. And we go for some houses, they don't have water since 2 or 3 days. They just have water from neighbors.
Muhammad, I want to build on this point.
There is no hygiene, because that we need to support the community to be prepared to not spread this. COVID-19.
Adding to this point, it's an important point. He said, talking about people, most of the people are poor. So if for samahullah, if like there is a COVID spread on all Gaza Strip on Palestine, and you ask these poor people just stay at home, like a domestic quarantine, how long they can stand and to suffer and stay at home? How long they can stay at home? They are like, we're given 2 choices, to die from hunger or get out or die from COVID. Yes. This is what we are afraid of.
So
most of the population, they are daily workers. If you work today, you will eat today. If you are not working today, you will not eat.
Even if they work today, their daily income is very
20
small,
shekel, like
very
$4.
$4
is not enough for anything. So if you want to buy 2 sabun or 3 sabun, it's 10 shekel. That means he will put half of his salary just to buy sabun or chlor or some hygiene material.
So they will have more priorities.
What about our government also? Like in modern countries, they like approve a bill of like assistance for all population to stay at home, like for those who like have low like living income to support them. What about actually our government need the support actually, so they are unable to support the others. So how can we ask people if they God forbid, what we will do? Can we ask people to stay at home?
Yeah, this leads me to the other point that when we mention the government, what have the government, what the measures and the procedures that the government, Palestinian Authority in the West Bank and the government in Gaza Strip, what the procedures they have done to prevent or to confront and stop the COVID virus from arriving to Gaza. So could you tell us and share with the people who are watching us what the procedures that have been done till this moment?
Okay. Let's talk in general in Palestine. Now the emergency status has been declared, for instance, the 26th of March, and they're declared for 2 weeks, and now they extended for another 1 month, beginning from the 2nd of April. Now in West Bank, in some governorates, there's a complete lockdown, and we're talking about this halt of all educational process. Most of public service has been shut down. Now gatherings actually now forbidden. For Gaza, like the same, all gathering has forbidden. But now we're talking from Gaza, still there's some movement, but gathering for big gatherings now is forbidden. Now groups of quarantine centers established in West Bank and Gaza Strip. Now for yesterday, recent statistics, we're talking about 32 quarantine centers has been established in Gaza Strip and about 16 in West Bank. Now, the purpose of this quarantine center for those who come abroad, they have to come and they have to complete about 21 days in this quarantine center. And they are tested, of course, and then they can be allowed to go to the yes. And there's also another treatment centers. There's actually good measures, and alhamdulillah we see some results of these measures. But the most important question, how much the government, how much they can continue this measures?
How much they can stand within these situations?
Yeah, especially as you mentioned in your statistics, you are talking about all our surrounding countries. Now they're infected
with very big
high numbers, big numbers of COVID. Now whether there's about we're talking about 3,000 travelers was stuck in Egypt. And now after we finish a first package of people that in quarantine and released. Now the Palestinian government or the authorities in Gaza now prepared to receive this part of this 3,000. They have received about 860 patients.
This moment.
Yeah, now in the quarantine centers, and they try to get more and more. But still, the possibility. What if one condition that or one patient out of control? Are we ready for this? Are Gaza Strip, are Palestine prepared for this?
Are we ready for this, Dr. Muhammad?
Inshallah, alhamdulillah. And we have in Gaza or in the Palestine, we have a great holistic approach that we are all the sectors that are working together. But we are working together, but we need some facilities, we need some equipment, we need a huge number of protective wear we need to use. We need masks. There is a siege. Imagine that. Gaza now manufacturing for some countries, but so inside Gaza
it's vice versa now.
Yeah, but in Gaza you exporting, but you need to buy it. You cannot buy it for its number. And from this live session, I'm very thanking a lot the white soldiers, the doctors, the nurses, the frontliners who's working, the police, the cleaners who's working in the municipalities to avoid this COVID-19 to come to Gaza. Are we ready to face COVID-19? We put the plans, but we need to work on these plans very well.
We stand with other people, yes. We can do the plan, but with the stand with other people, the good people.
To support these plans to succeed.
Yes. Imagine huge countries like America, like most development, the most rich countries, when they cannot face the COVID-19. In Italy, every day we hear a huge number of infected or deaf people.
Or around 1,000 daily they pass away.
Yes, and in America.
Even in Malaysia, they are struggling actually also.
So in Malaysia also there are 83 cases that passed away till this moment, and more than 5,000 infected cases. So I would like to use this to show the solidarity, to express the solidarity with the people of Malaysia and in Indonesia, and the people of Palestine. They are making daily dua for those infected ones to be cured and get back to their beloved families. And we pray that the ones who passed away, that Allah subhanahu wa ta'ala will consider them as martyr, as he promised his people that whenever there is a disease, you just sit down and listen to the instructions, and to make that as sabr and patience, and this will be rewarded by Allah subhanahu wa ta'ala.
And also don't forget the frontliners and their families. Our sympathy goes to the frontliners, the one who that trying to fight the COVID alone. In all the world, especially on Malaysia, Indonesia.
Our respect to them, because they are the ones who are facing the battle. They are the real soldiers at this moment, that they are facing the battle and stopping the spread of the Covid-19.
And also, since the beginning of the Covid-19 and the procedures came to Gaza and the government make some procedures, actually we thank a lot Palestine, Malaysia, because we thinking with holistic approach. We need, since the beginning, we make a holistic approach as a Salam charity and Palestine, make holistic approach to work with all aspects. We are not going on with this campaign to work with the infected people or the community. We prepare a holistic approach to work with all aspects, to cover all the
in all Palestine.
In all Palestine. And we will, inshallah, we will work in Gaza, in Jerusalem, in West Bank. Also, we will work with government, with the Ministry of Health, with the municipalities, with the NGOs, with the population, with the people who are affected due to the blockage of life in Gaza, and inshallah we will get our target. We will face or we will struggle to implement this huge project, and I think that inshallah we will do it with a good donation from our beloved and our brothers in Malaysia.
Let me, before I ask Brother Muttasim, I have a question for you. What about the handicapped or the disabled people, the reality of them, the reality of this group who's living now in Gaza, mentioning that the life of Gaza is being very difficult, the economy is being fragile. So the ones who are, let's say, in healthy, they can go out and they work. But what about those disabled or the families that have disabled? So could you describe their situation at this moment?
Gaza Strip is the highest number of the people with disability around the world. We talk about 54,000 disabled people. They are living in Gaza Strip. That's
army of disabled.
Yes, we talk about the highest percentage in over the world, 2.5%, and it's the highest between all over the world. And when we talk about the people with disability, we talk about they don't have a good immunity. And also we talk about the elderly people. We have a lot of people that are elderly, and when we combine these together, that we have a huge number of population, they are they have lack of immunity. Because that we start in As-Salam Charity, we do some good awareness for them. We go to their houses, explain for them for COVID-19 how they can to ask them to stay at home, don't shake hands, don't kissing.
Make social distancing, even though it's difficult to do it in Gaza.
Especially they are living in isolation, and they have some psychological problem. It's better for them to go outside, but at these moments we ask them to stay at home, don't go outside, and we explain for them for COVID-19. Imagine that we go for some houses before last week, and we told them about there is COVID-19, don't go outside. This is the first time they heard about the COVID-19. They don't have TV, and they're just sitting at home.
So we can describe them that they are living not difficult but very difficult situation, because they are away of social media. They can't provide the means to be connected to social media and to be connected to the latest updates.
Also, we providing them with hygiene kits, and this hygiene kit is very important. I explain for them how they can hygiene. Also for the wheelchair users, we make sterilization for their homes and for the wheelchair
surroundings that they are
devices
moving,
that they use. and we tell them how to make some procedure if any visitor they came to them, how to make some sterilization and providing them with this.
Can I ask Brother Mutassim to tell us about, speaking about this point, the interventions of Aman Palestine during this COVID-19, and whether Aman Palestine is going to work in Gaza or on all of Palestine, West Bank and Jerusalem, and how?
Alhamdulillah, during this previous period, we discussed with many partners in Gaza Strip and West Bank and Jerusalem. We reviewed all international and plans. Alhamdulillah, now we have an appeal now for all world, especially for our beloved Malaysia and Indonesia. There is three targets or three important interventions we have to focus on, especially in Palestine. The first thing, we have to support the health facilities and the frontliners and their families. Now health facilities need this more than before, and especially the frontliners. Many frontliners now, as Dwayma said, they go to the quarantine center and they have to stay with the patient.
They have to stay for 21
days
away from
now
their
it's up
families.
to 28.
Yeah, what about their families?
Extended up to
Yeah,
28.
28.
So, yeah.
What about their families? And especially before the pandemic, actually, they are getting about 40% of their
Yes,
salaries,
40%.
not every month,
Yeah.
every 50 days.
Every 50 days
Yeah,
or 40 days.
we have to support the frontliners, the medical efforts, the health efforts. Actually, the good thing, we're not working alone. This is maybe one of the values of our intervention. We always try to work in coordination with all our partners, with all actors in government, in UN agencies, with NGOs. This is the good thing. We will work in coordination with everybody. We will focus on this first population or first classification. The second thing we have to focus on also regarding the people, the infected people, actually, the people in quarantine, and also their families also. Talking about now we are talking about 860 patients or
At
people.
this moment,
In the quarantine. What about their families?
Days.
Yeah, usually. What about the families? How we can support them? Now they need shelter. They need shelter equipment, non-food equipment. They need meals actually inside the quarantine centers. Government cannot support them with all of those things. Now we have to support them with food meals. We have to support them with non-food items. Also, we are talking about the vulnerable people. As Mr. Muhammad said, we're talking about there's many vulnerable people affected from the pandemic. Now, we're talking about the hospitals or the health facilities. Now they're all focusing on the COVID-19. And most of the outpatient clinics has been now closed or minimize the services to the minimum level. So what about this vulnerable people? What about those who lost their income because of the pandemic? So this is our third target, inshallah. This is about the target. We're talking about in details the interventions. We separate or we divided our intervention to five sectors. The first sector will be health sector, and Mr. Muhammad will help me. First intervention we done with providing alcohol sterilizer. Yes, we also need to provide Gaza Strip with more COVID-19, more kits for testing. Actually, now before 2 days, the Ministry of Health announced that there is depleted all the store of testing kits. This is the first important intervention. We also have to provide with the health facility the people in duplicate bases with PPE, the protective personal equipment. I think we have one here. Actually.
We bring one.
Yeah.
And,
Are they available in Gaza, Dr. Muhammad?
yes, alhamdulillah, and we have some factories they are working in. And in the
So this is one of the samples.
Yeah, this is a small sample. We will provide the protective personal kit, and this one is will be include the we'll put the gloves for the staff, also the face mask, the glasses. We have these glasses. It's also we will pay the protective plastic also mask, and we will put and this. We will have this.
Yeah. One PPE cost 60 USD.
Yeah, I was going to ask you about the cost.
This made with good material. It's you can sterilize it. You can use it for many times.
So it's not only one-time use.
No, it's not only one times. And we will provide it for the staff and the Minister of Health, the frontliners, and municipalities and any people who's working with the infected people. And this is very important because there is a lack and there's a huge number of frontliners because each 30 days the teams changed because it's not logic that they will stay with the
and the people will change also.
Yeah,
Because the people will stay in 28
days. After that, they will
they
change
will
the
go
shift,
home if they are free of the coronavirus test and they are negative. Then they will go home, and we will receive another batch coming, returnees coming back from abroad.
And this one is national
made.
Yeah, it's made in Gaza, and Gaza exporting this to all over the world.
Oh, Alhamdulillah, so exporting, but because people we have to clarify that they are exporting this to the world, but because the world they are sending the raw material for Gazans to work on because they have the deficit and the lack of it, but the facilities and the hospital and the staff in Gaza, they are still deficit and in lack of this, and so they need them.
Also for the mask, we'll bring a special mask, not the disposable one. We will bring a good mask for multi-use because it's for the frontliner. It should be completely special, very good for the COVID-19.
Okay.
Going back to the testing kit, so one testing kit is cost about 2,000 USD. It can be used for 100
patients.
Yes, 100 patients. Yeah.
So one testing kit can do tests for 100, but it's 2,000 per kit.
Yeah, but we're talking about 3,000. Still have to enter Gaza and go to quarantine center.
They came from Egypt, and we have another number.
But Dr.
This came from the borders, from air's border between occupied Palestine and Gaza, and this number of the workers, the people who's working in Israel or the people who's going for treatment in Israel, and this is high risk patient because. As you know, that many workers who spread the COVID-19, they came from Israel in the West Bank. And I think it's something that
will be a tragedy in
Israel, that they don't treat the Palestinians. They just throw them on the borders and they go there.
Actually, I read reports about this also. They are talking the same. They're giving priority for the
Israel. So discrimination also within the spread of COVID-19.
There is discrimination between Israelis. The Israeli community is very weak, and if this Israeli from Russia and this Israeli from Africa, they prefer they have some discrimination between.
So they discriminate between their own racists also.
Yeah. Also, imagine that one Arabic or one Muslim he came, they refused to treat him. And
I want to ask about coming back to Gaza, the ones who are in quarantine centers. Let's say at 8 there are 800 at the moment, but they do 800 tests for each a day, right?
No, they make it once.
Only once.
Yeah, they put them in the quarantine, and they wait for 14 days. Anyone have, because we don't, the best way to make tests for the whole number, but we don't have full kits. Okay, what we will do, we put any number of the people who need to stay in quarantine and wait for 14 days. Anyone who have signs, they go to the treatment, or they make test to make sure. And if there is no signs, they wait to 21. Then they make test for any signs came. But if we have the old kits that needed to make test, it's better to go immediately to make the time less time, to make less time, and to make to have good result, not to discharge the people,
the patients,
or the people, the quarantine people. Then we discover that this patient, this one, he have COVID-19.
As you see, Minister of Health is trying to be wise in using the resources, the real resources.
Can we proceed
back to interventions? Talking also, we need also to one of our most important interventions to equip the ambulances. There's some ambulances specialized for transferring the patients, especially COVID-19. So most of our ambulances they're not well prepared for this process. So if we can equip one ambulance by 7,000 USD, it will be ready and to be used for transferring the cases.
The infected
Yeah,
cases
the infected
inside
cases.
Gaza.
Also, the many there is many like public places. Also, they're demanding for the infrared thermometer. Yeah, it's important for them. So, like to make like early discovery. Yes,
We are using mercury thermometer, and it's not affected in the COVID-19 because it's give good result, but we need
Something
there
no
is
touch,
no
yes.
touch,
Yes.
there is, because if you use this
With many patients,
mercury,
then
we
it's-
need to
Yeah.
sterilize, and it will take time. Also, it's very dangerous for the health worker because
Yes.
there is a complete touch between the patient.
Also, another important intervention we need. This plan is not only for response, and also must be for preparedness. We have to prepare for the worst scenario. Also, for example, now if God forbids that the COVID-19 spread and all of Gaza Strip, we have to be ready that the Gaza Strip may be like in some areas in West Bank will be like separated or like try to make the areas to separate the areas like small quarantine, so nobody can transfer from one area to one area. So the problem is how those people in these areas, how we reach the medical services. So we can now prepare for like mobile clinic. We can intervene in several areas. We provide them with like mobile clinics, with doctors, with nurses, with some consumption, yes, to provide at least the basic medical services. This, yes, for the people.
So, excuse me, Mutasim, I would like to use this chance to ask the people who are watching us at the moment and the ones who will see the video afterwards that this is a chance for you to make donations to Aman Palestine if you want to help those people in Palestine to provide these interventions and to provide the basic things that the teams are speaking about. You are welcome to donate for Aman Palestine, to donate for Palestine through Aman Palestine on the bank accounts that appear on the screen at the moment. And you are welcome to do like, share, and subscribe for the YouTube, for the Facebook pages, and for the Telegram channel, and for the Instagram pages, Instagram accounts for Aman Palestine, to be updated up to the minute with the interventions of Aman Palestine, with the situations in Palestine, and with the interventions of Aman Palestine, the work that you have donated for the people of Palestine. So you are most welcome to do your donations to Aman Palestine. And again, I want to remind you that داووا مرضاكم بالصدقات, the ones who have ill people, you are invited to do sadaqah with the intention to Allah subhanahu wa ta'ala to cure them from these diseases. And من أحيا نفسا كأنما أحيا الناس أجمعين, the one who saves a soul as if he has saved all humanity. And imagine how Allah subhanahu wa ta'ala will double and triple these rewards for the donors. So let's get back to Brother Mutasim to continue of the interventions of Aman Palestine for the COVID-19.
Yeah, this is talking about, yes, health sector. Still, there is two interventions also. We try to struggle hardly to do it. Providing, as we mentioned before, our ICU bed capacity for 2 million people is very illogical number. So we try to provide the Ministry of Health with more ICU beds and more ventilator. But actually, this is a challenge now in this situation that there is all
over the world.
Yeah,
there's
no
shortage. Manufacturers that provide.
Yeah, shortage of these two items and all over the world. But also we will try to work on this issue, on these two fields.
I want to add something for the emergency mobile clinic. It came from the request from the Minister of Health.
Of course, yes. We are working with coordination with all
because the Minister of Health now they already put the plan, and it's very necessary because we have around 9,700 patients from the Great March of Return. They need treatment.
Up to this minute.
At this minute, they are spread on the
Gaza
Strip. Also, we have weekly, we talk daily. We have many thousands of the people who need treatment for some flu, from the diabetic, from blood pressure, and
for primary medication
the primary healthcare centers. It's already closed. And there is some decision they maybe start working next month Sunday. We don't know according to how many cases we have.
Or decrease the number of the working facilities.
Yes, Because that this emergency mobile clinic, it's something of the plan that will make less demand on the Ministry of Health and distribute the work between the NGOs.
So this is
in
one
the
of the
center.
most important interventions to arrive to the people in their areas
Yeah.
and not ask the people to come to the areas that we need to do the intervention in. But this mobile clinic, the crew, the medical staff will arrive to the people doing the tests for them and doing the daily checkup that they need.
Yes.
So this is the idea of the mobile
Yes.
clinic.
Yes.
So as you mentioned, this health sector, like some of part of of the interventions will be focused on supporting the health facilities. Moving to the second intervention sector, we're talking about food security. Food security for the people and providing food meals and food parcels for those in quarantine centers, for the frontliners and their families, for the vulnerable people actually. Now they are in need for food parcels and food meals and for cash assistance now more than before actually. Now, as I want to go back to the point I raised before, talking about people that lost their income, talking about frontliners that they barely get 40% of their salaries and they are away from their families now, and talking about the people in the quarantine centers. So the second sector, we really we can now provide them with food meals. Food meal maybe cost about 5.5 USD. One food parcel would cost 40 USD, and we can provide cash assistance at least 100 USD for each family. So this is one of the intervention we can do, not in Gaza, in all Palestine.
So I consider this also one of the most important things also because the people in normal conditions without any crisis, it's
course.
difficult. They are suffering to provide their daily living, food and income. But when it comes to the coronavirus, it adds the burden on the shoulders of the families.
For good immunity, you need good food also. For healthy, you need
and
healthy
fresh food.
And also, يعني إن شاء الله next week is Ramadan. كل عام وأنتم بخير. Ramadan Kareem. And Ramadan, the people here in Gaza, it's in special situation. And it's very, very different situation that all people, they came, they collect together. And there's a big demand on the father and the sponsor of this family. They need to bring the food. The families came to him. And this situation need a good solidarity with these poor people, the people who's... And imagine that Ramadan came and the front liners, they are not
with their families.
Yes. And it's psychologically, imagine that my kids, they are not... they
cannot see me.
Cannot see me.
Yes.
And
Well, again, this is happening all over the world now, especially the Muslim countries who are practicing and fasting Ramadan. Also, like our brothers and sisters in Malaysia and Indonesia, those are also experiencing the same thing. But this is their first experience to be away for 21 days or for 14 days or for a long time out of their families. But this reminds me of the Palestinian detainees and prisoners who are in Israeli occupation jails, that they have been living this distancing or like being put behind the bars for long years now. Some of them spend around 30 years plus in jails. They are prevented from seeing their families. But again, like this is the first experience for those countries abroad within this situation that the main sponsor or the head of the family is away of their family. But we pray to Allah subhanahu wa ta'ala that this ends as soon as possible, so they come back to their daily life and they come back to their normal life. So can we continue on the intervention?
For our third sector, we have to focus also on sanitation and hygiene, of course. Now we have like some coordination with municipalities around the Gaza Strip to provide them with the chlorine liters. 1 liter of chlorine, concentrated chlorine, costs about half USD. So we can provide them with these materials so they can go and complete their effort to disinfection of the public places. For now, you know, of the 32 quarantine centers at Gaza Strip, now about 15 centers like now is under disinfection now. So we have to support this effort of disinfection of public places. Other way, we can also like disinfect. If one, for example, in average, if one to disinfect one place, it may cost you from 200 USD to 300 USD. We're talking about the equipment, the materials to infect one place. Considering it regarding this point, I have to mention that our projects actually in Amman Palestine now actually is closed. We're talking about Masjid Imam Shafi'i, Masjid Al-Qassam, Quran School. They are now all closed, and also they need disinfection. So we can also intervene in this issue. Also, we have to provide hygiene kits. Mr. Ibrahim will tell us more about the hygiene kit.
Yeah,
What the ingredients of the hygiene kits?
Yeah, we have many people. They are inside the shelters and inside the quarantine, and we have another number of the people who have like people with disability, the people who have less immunity, the cancer people. We need to providing them with hygiene kit to have some personal hygiene, and we prepare the sample for hygiene kit. This will be include hygel. It's this hygel to make sterilization for the hand, or the toothpaste and toothbrush, and this is for the hygiene.
People in the quarantine centers, yes.
Yeah, at this quarantine.
Because you know, people in quarantine come directly from travel, come directly to the quarantine center.
So they don't have the chance to go home and get these things.
No, they are not allowed to go home. You know, they are not allowed even to take their bags. Their bags must be at least be away for some time, and we must disinfect it before they give them back.
And one important point that they are traveling and they have been staying for long days in Egypt, waiting, so they are out of money.
And most of the savings, yes, are depleted. Yes, during the waiting.
Wipes also, tissue, and antiseptic solution, and this all for the hygiene. This we provide for the one patient, and if it's not enough, we need also we have face mask, gloves, and the same hygiene kit.
One hygiene kit costs average 10 USD.
$10.
Yeah,
and
$10.
It's very important for the people who have lack of immunity. And this is a sample. It will be bigger than this. Also, when we talk about the sterilization for the area, public places, and the for chlorine, you know, the municipalities in the Gaza Strip, it's clearly they are suffering from financial crisis since many years, and the main rule that we're thanking them a lot that they are remove the garbage from the city, and they imagine that in Gaza Strip we still depending on the old
ways of getting
we use
rid
the
of
donkeys and this
the carts,
the carts
by animals.
It's imagine it's not easy that when you go outside Gaza you find all the facilities for the municipalities, but here in Gaza these carts collect from the houses going to the main main place to they collect this place inside the city, and this is the source of infection, because that we need to support all the frontliners and the municipalities, all the
especially the cleaners at this stage.
And I surprised that they are using the normal face mask.
Well, this is what's available in Gaza.
It's what's available for the municipalities also. And we cannot say the municipalities should and don't have anything to do.
I read in the Ministry who in the web page that this mask is not medical. They have to be to put it without any opening.
There is many kind of face mask, and it's many categories according where are you working in. But for frontliners, especially for the cleaners who's removing the garbage from the quarantine, they should fully protected.
And they have the special face masks.
And they need, when they finish collection and everything, before they go into homes, they should be sterilized, because we are afraid that if one
is infected, then will spread the virus and all over the Gaza Strip.
Yes.
Any more interventions are we going to?
Still, we have talking about the last two sectors of interventions. The fourth sector is shelter and non-food items. As I mentioned before, travelers come without any preparations, so they need mattresses, they need blankets, they need they need fans. Some in the quarantine rooms. Actually, quarantine rooms. Most of them are schools, schools.
Yeah, schools are being used for
recently, there's about 500 rooms in the north has been built, and another 500 in the south. But still, there's need a lot of preparation.
Yes.
Also, we're talking about there's high temperature here in Gaza, so
it's already summer.
Yeah, we have to provide them with fans also, at least to provide them with fans. And also we have to provide them with Islamic worshipping kit. Many people, and there's coming Ramadan, and at least they don't have the rug to pray. We can have a sample, I think.
Yeah, we have for this issue, we have something unique that we thinking to do it in Ramadan, especially Ramadan is came, and we have this miswak we give it for the people in the quarantine, electronic rosary.
For the praying.
Yeah.
Holy Quran.
Holy Quran.
So to spend their time during Ramadan
Yeah.
and during
What they
their
are
time
It's
also.
28 days.
Yeah.
Yeah. We have towel.
And the prayer rack.
After wudu, they can use it, and the prayer.
Yeah.
And this is very important that each one he have his own,
Yes, of course.
because if they are in a quarantine, we can, yani, if one he is in quarantine and they are praying, they take from each other this source of infection.
Yeah. We
Because
don't.
that we
try
prefer
to.
that each one he have his
Of
own,
course.
and we will give them some instructions. It's in the pamphlet. It will be in hygiene kit, and in the any kits that we providing for anyone, there is a pamphlet. It's talk about how the procedures
to
about
use them and the instructions
yeah,
how to what
about
to
the
do.
coronavirus,
Yeah.
how it's spread, what you can do, what is the first stage you will do if you discover some signs, where to go. Everything is explained in this.
Okay, this leads to one of the interventions that of the raising awareness amongst the people, right?
This
Raising awareness
this
is 90% of the control of
Yeah.
And this is our 5th intervention, actually. But before going to this, I must to make sure that during delivery of these things, we have also to make sure the process. We will put like some measures to make sure that we will not be a source of this
Yeah.
infection. Yes.
Yes, of course. We will sterilize
This will
these
be
materials.
cleaned, sterilized. with
And the people who are
alcohol.
working on them actually will be like wearing the PPEs and the mask and be also disinfected. Our last intervention, and it's important intervention, we are talking about the risk communication. As Muhammad Ibrahim said, he's talking about many elders don't know there is a COVID, right?
Yes.
So we have also to invest also in the communication, invest also in awareness and education. Now there is, we will try to put like billboards in the public places, and also through social media we'll try to produce materials like awareness materials through the social media and promote this awareness materials. And of course, as Muhammad said, that yes, awareness is more important now, especially for this time. So we can decrease the number of this infection, and our Ministry of Health can deal with this number of people.
So we say that we spend a little on the awareness, but we'll have big results, inshallah.
Yeah. The last thing I want, this all details or all information will be available. The appeal will be available, inshallah, on our webpage. On full details.
For anyone who wants to have more details for the appeal that Aman Palestine has issued. For the response and for the urgent intervention to fight the spread of the COVID-19 inside Gaza Strip. Well, as a final message to the people and to the people who are watching us at the moment and to the countries that are infected, especially, we are asking them to make donations to Aman Palestine, and they are infected. So what is a final message that you send to them during this appeal and during this time?
Well, there is the most important thing to know that coronavirus don't know any borders. Of course, they unlike the Gazan people or like any people in the world, COVID-19 don't know any borders. If there is still coronavirus in any country, all countries will be under danger to be infected. The other thing that is, we know that our brothers is still suffering from COVID-19. That's the most important question. Why should, maybe we raise in some minds, why should I go and help others? I already need my help to help myself. But the good thing, maybe I'm looking from another view. I think it's a chance of sympathy, because now we are feeling what we are feeling from 1948, how we to live under lockdown and quarantine, and how to live under a crisis. So I think it's a chance to sympathy, to feel what we are feeling in Palestine. So I think, yes, it's a chance to help us. And the most important thing, we cannot do this alone. Yes, we have our plan, we have some measures, and people will try to suffer, but how long? How long we can do this plan? We're not talking about Ministry of Health or international organization. Yes, they put some plans, but maybe less than a quarter of their plans has been funded yet, and still we don't know what will happen, what is the future. So we need your stand.
Dr. Muhammad, final message.
Yeah, my final message for the my lovely Malaysian, and we have a good relation with Malaysia, especially me. You have good relation. Don't make pain for us. When we hear that some Malaysian, Indonesian, and when we hear that there's a coronavirus in Malaysia and Indonesia, it's like a shock for us, and we like them a lot. Please stay at home. Don't go outside. Don't shake hands. Keep this social distance.
Yes.
And you can do everything. If you want to donate, if you want to work, you can do it at home. And this world, if you are going to do a lot of things, it will not finish. You just stay this moment at home. And really, when we hear that someone from Malaysia, from Indonesia, from any Muslims, that he passed away due to coronavirus, it's like a pain for us. And I visit Malaysia many times. I don't imagine that one time I will lost one Malaysian friend. He going.
God forbid, inshallah.
Yeah, inshallah.
We never thought that Malaysia will live under a crisis.
Yes, and imagine this
Alhamdulillah.
very kind people, and they are very respect people. They like us too much, cause that my message: stay at home, don't go outside. You can do things from home. If you need some facilities, we can help you from here. But
I think they need the most the dua from here now.
Yes, inshallah, and we will not forget them. And this work and this huge planning, we cannot do it alone.
Thank you
The
so
stand
much.
should be came from them. Thank you very much.
Thank you so much for joining us for today, Dr. Muhammad Dweima, and thank you so much, Engineer Mu'tasim Mansour. And as a final message from me, and on behalf of Aman Palestine, and on behalf of all the Palestinian people, that Gaza and Palestine have been living under the lockdown since 1948, and now the whole world is experiencing the same. So it's a chance to demand the international community to lift the siege on Gaza and to end the occupation of Palestine. And this is an invitation for you to make dua for the people of Palestine. This is an invitation to make dua and to make donations for the people of Palestine through Aman Palestine, for Aman Palestine accounts. From any place in the world that you want to donate for Aman Palestine, you are welcome for donations on the bank accounts that appear on the screen, and on the bank accounts, on the accounts of Aman Palestine on all the platforms of social media, on website, on Google, on Facebook, Instagram, YouTube. And please share this video and subscribe for the YouTube of Aman Palestine to share and to arrive.
Spread the word.
Spread to all over the world. جزاكم الله خير وبارك الله فيكم والسلام عليكم ورحمة الله وبركاته.